Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Would you encourage people to add running to their exercise routine?
In general, again, with people having very limited time to exercise, you want to choose more strength training exercises in general first if you have a limited amount of time. If then you're going to add in a second form of exercise, I think something cardiovascular, interval training, short distance sprint walk intervals, walk jog intervals is going to be better for overall health benefits than long distance running. From that standpoint, but I think having a component of, again, a strength training component and a cardiovascular component will be beneficial. The one thing to remember about running is it puts a lot of force and a stress on someone's joints. So if someone has a history of arthritis, they're better off biking and swimming than they are going out and running, 2 miles, 3 miles, especially on things like asphalt and pavement. I'll try to tell my runners to stick to track or the trail or even running at the beach because of the cushioning of the sand is beneficial than running on asphalt or pavement.
Who should not run?
Anyone who has significant, arthritis, those are the type of people who should really, avoid running altogether. But really in general, I'll tell my patients, even if they have mild arthritis, let pain be your guide. Running on back-to-back days isn't something that I'm a big fan of because, again, you're loading the joint forces back-to-back days, not giving the body a chance to recover. I'd much rather have someone run just 2 or 3 days a week and supplement the other days with strength training or cross training to give the joints some time to get bounce back, so to speak.
What should people do if they're starting out as runners?
Sticking to a trail or a track, something that has a softer surface. I think keeping the mileage very low. I'm a big fan of, again, like a walk-jog interval that a lot of the Couch to 5K plans really include. Also making sure, again, they're not ramping up their mileage too quickly and that they're doing some sort of lower body strength training to keep their quads, glutes, and hamstrings strong. Those are the things I would do for beginning runners. A lot of runners, if they have a big loop, or is to make sure keep the loops shorter. So if you do start to get an injury, you start to get tired, you're not too far from home to turn around and come back.
What type of gear do they need?
Having an app on your phone that you can check the weather, you can check the humidity, the wind, how fast the wind is blowing is going to be important. I think in the summer, having socks and shoes that are going to wick moisture away, so when you start to really heavily sweat. I think that in the winter, covering your head, covering your ears with some sort of headgear, wearing gloves in the winter, dressing in layers I think is always important because you may be colder when you start out, and as you get warmed up, having some layers you can tie around your waist, things like that I think is going to be important. And obviously, with the sun over the summertime, appropriate sunscreen, things like that. And even in the winter, if it's very windy, you can get windburned. So having some sort of sunglasses or something around your face is going to be helpful as well.
What is a good goal for a new runner?
I think the first goal of any runner is to make sure that they don't get injured from their running program. I think the first thing is to keep yourself running, keep yourself motivated. I think the second good goal for a runner is to make sure that they're trying to, again, accomplish whatever goal they set out, but break it up in steps. If you've got 3 months to run a 5K, then break it up by 1 month. I want to be able to run 1 mile consecutively. By 2 months, 2 miles, and then by the 3 months, that full 3.1 miles on the 5K. I think that if your goal is just to finish a marathon, walk-jog intervals are going to work nicely. You don't have to run the full 26.2 miles. You can take walk breaks along the way, and sometimes that's even better at preventing a lot of the overtraining injuries.